It was in a team context that we took it. So then the facilitator a week later sent us the spreadsheet that had all of us in rows and all the strengths as columns. And then you could kind of find yourself and you could go across the row and then you could start to go across columns. It's like, wait a minute. I actually notably was the only one of our 40 faculty that had in their top 10 the futuristic one, keeping an eye out on the horizon, early adopter. So yeah, I mean, so then I'm a logical tap for the technology task force at the university level for representing the PT program. So very helpful for management and leadership. That was really cool.
Mike Pascoe on the show. Mike Pascoe, welcome back.
Yeah, hey, Jimmy.
Coming to us from Colorado, and you're at what, Colorado Anschutz?
Yeah. The campus is the Anschutz Medical Campus, and that's in Aurora, Colorado.
And what do you get to do there? You get to teach, and you get to teach A&P, and not just for PT students either, we were talking about.
You got it. On paper, my contract says 80% teaching, and that is anatomy, and that is PT, and that fills up, about 60%. But now I am wrapping up PA anatomy, and I get to finish out the spring with some MD anatomy as well. So those are the three groups.
And you got something pretty new. Showed up in my mailbox. I know it's new because it showed up in my mailbox, and it smelled like a new book. It smelled like a Barnes & Noble, man.
It's a great smell. It's a great book. I'm glad it made it there safely. Did it any dents, any dings?
No.
Good.
Okay. So tell people about the book. It's anatomy. What's new about it, though? I mean, this is the human body, Mike.
That's right. I think we've known about the human body for a while. I think that there have been atlases out for a long time, and I'm partnering with a group called KenHub, so I'll plug them real quick. They're the brains behind the operation, and they were looking for somebody to help them in the anatomy education space, somebody to serve as editor. That's a great opportunity for me at my career, at my station in academia. So I jumped on that very quickly, and I thought, wait a minute, what are we doing here? Let's survey the students, because really as a teacher, you need to talk to the students pretty often. So I talked to them and I surveyed them and said, here are some questions that we have. What would you like to know? So I mean, this is a long answer, Jimmy. There's a lot to go through, but basically students were hungry for an atlas that was more portable, that was more succinct, still has great illustrations, of course. That's the bread and butter. And they really wanted something that was inclusive in representing the human body. So you're right, it's anatomy. It's been around for millennia. I'm sorry to say that the body's been mainly represented as male, white, and hypermuscular. So let's see what we can do to change that, because we know that we can do better and students are ready for that. So they've been ready for a long time.
Plus, I'm guessing like teaching methods have changed, technology changes, so you can teach this even if nothing changed, right? You can still teach things differently and make it easier, more clear, things like that.
Oh, you got it. I mean, at University of Colorado, my primary appointment is with physical therapy, and they have been really innovative in developing new curricula. So we're going to jump into the hybrid space, and we're going to do a hybrid DPT program. Our first cohort matriculates June, and you know what PT school begins with? It begins with anatomy. So I'm in meetings and developing things all week, all month, just leading up to June where we launch this thing. And so the way we teach that and the way anatomy is going to look in a hybrid curriculum is going to be way different than the residential, but it will still be good.
Yeah, that's great. What is you sent out a bunch of copies to this book. We'll throw out the name first just so everybody, knows. Put the link.
Yeah, let's take a look here. The KenHub Atlas of Human Anatomy. Nothing too disruptive there in terms of a title. Atlas of Human Anatomy. So that's what you're going to want to look for. It's available on all the book platforms you can imagine. And it went up in late October.
Yeah. How'd that feel when you actually held a book that you were part of in your hands?
Yeah, it was cool. I mean, the days are over where you get the press proofs for the research papers that you write. I did that in grad school. Felt like another era. But yeah, it's really cool to have something tactile. And that was a big question. What's your preferred format, Jimmy? 51% of students in my survey results here said they would prefer a paper atlas. So there's something about that analog, that tactile, and it was really cool to have it in my own hands. Yeah.
That's interesting. I mean, 51% isn't, what was the other 49? Was it just digital?
36 with electronic, and 10% said no preference.
I'm sure the stats people would have more to say about that. I mean,
Sure, sure.
was an option for both? Of course, people want both, want more. Everyone's
Yeah, I use both the same amount was an option, but that wedge is so tiny, I don't think it registers even as a 1%. But there were a handful of the 100 or so students that were surveyed that said they used both the same amount.
Yeah, I went to PT school just a couple of years ago, and I used both.
Yeah,
And
yeah,
it
it's all
grew.
good.
I think when we would project it from the iPad onto the screen, that was kind of fun. But I still did like to have the anatomy, the whatever atlas I was using in front of me.
Yeah, I mean, there's a lot of follow-up to ask there, and I don't know if anybody's put that in the anatomy education space in the literature. I'm not fully aware of it. I know there's a lot said on analog versus digital note-taking, and there's a pretty famous study that shows the pen is mightier and all the puns. And so, yeah, note-taking by hand has something to it, and I wonder if looking at an anatomy atlas has the same, qualities.
Digital tools is something I play around with. Actually, Rick, you know who Rick Rubin is?
I don't recognize no, what do they do?
So Rick Rubin produced the Beastie Boys and Jay-Z's Black Album. So he's like this guy with a bushy beard.
Ah,
And he talked about digital versus analog and how he creates. And like, of course,
mhm.
this dude can afford all the digital tools in the world. And he's like, I really like pen and paper. Steve Jobs was famous for saying like PowerPoint was the worst thing ever invented for creativity. Even though Apple had Keynote, a lot of people that I talk with who are stuck in giving presentations, or they're like, I don't know how to bring my presentation to the next level. I always start with, what's your process now? And so many of them are like, well, I open up PowerPoint, and I'm like, there's your first mistake. I still go to what Mrs. Gridley taught me in 11th and 12th grade English, which was 3x5 cards. If you're going to outline something, and every card cannot have more than one idea. It's just and the reason there are cards is you can move them around. So when I
Cool.
start projects, I don't open Canva, I don't open PowerPoint. I take out Sharpie markers and 3x5 cards, or Sharpie markers and Post-its. I go between 3x5s and Post-its. Or a dry erase board is as digital as I get, which isn't digital at all, but it's a little more fluid. But I like that sort of like tactile
Yeah.
thing. Actually, there was one guy, I forget who I was reading. He's like a creative person, design and building. And in his office, he has a digital desk with his computers,
Mm,
cameras, and whatever microphones on it, and he has an analog desk. And he
yeah.
said all ideas come from analog, and then they don't leave analog to go to digital until at least there's a wireframe, right?
Okay.
So I think that's like why is Jimmy doubling down on this? I think that's what anatomy and physiology is. I actually took it second semester, just how it was structured, but you're not
Cool.
going to leave first year and do PT
Mm,
stuff. Like that's when you started to do PT stuff after the first year. But you can't. There's that analog education, which is, let me see how these things are put together and how it really did. It opened a lot of it connected a lot of dots for me.
yeah, it's right. And I think the only thing I could really say to add my perspective is really to borrow from my colleague's perspective. She leads the anatomy for the medical school, Dr. Danielle Royer. She says, until we have digital patients,
Mm,
we won't have digital donors, right?
yeah,
Like, it's hard to imagine doing what a clinician in general does without analog learning and seeing a real human body. And I know not everybody has the privilege of access to
yeah,
that stuff, but
yeah,
there's meta analyses that seem to come out almost every other month in the anatomy education space about the role of digital tools in anatomy education. And the punchline is always, it's a good supplement, it's a good amendment. And if you don't have real donors, it's okay. But if you do have donors, that's still the gold standard. And we're talking about sophisticated studies with learning outcomes, not just learner preferences. We're talking about actual performance of retrieval of knowledge. It's superior with the donors. So
yeah.
we're going to hold on to that as long as we can at the University of Colorado. Yeah.
Do you know Sky Donovan? She was my anatomy professor. Do you know Sky?
Oh man, I think we have met. I know the name.
She works
Yeah,
with the PTA a lot. She's kind of everywhere, and she's
cool.
been like, but she like literally. I remember when you get the item list for graduate school, and she was like color pencils, and I was like, why? And like her handouts were like drawings, like color, and I remember being like, this is why are we doing this? And it helped me so much to actually be like,
Cool.
okay, I'm gonna spend. Okay, that's where this goes, and then it was like the supplement. I think we drew it, we colored it, then we went to lab to sort of like look at it. It
Mm,
was like, oh, because this is 2-dimensional, but it was a good sort of flat
yeah.
representation. Got it. Now we're gonna go see how this thing is actually done in space in 3 dimensions. I was actually explaining this to a friend today. She has some swelling in her leg, and she's like, I don't understand why you're telling me that I have nerve pain. And I was like, okay, so there is some space for stuff, and then swelling makes less space. And when
Yeah.
there's less space, there's pressure. So I think, I wasn't looking at him, but I'm
Mm,
like, I think that's the reason. Oh, okay. I guess I didn't think about it in 3 dimensions, but that's kind of how we do.
that's what we're
You
trying to do.
you mentioned that typically anatomy is represented as sort of middle-aged white guy in pretty solid shape. I remember Sky, my anatomy professor, sort of saying the obvious thing, but it's not obvious unless you've heard it. I remember her saying, like, okay, most of our cadavers are going to be older and not in great health. I remember being like, what do you mean? We're not having these great, but how funny is that from my perspective? Because that's all I've been shown, right? That's all we've seen. I was like, oh yeah, people in great health typically don't donate their bodies to science, and we aren't dissecting them. And I
Hmm.
remember thinking, well, duh, but it took her saying that for me to go, oh yeah, I guess. So she's like, you're going to find things that maybe aren't on the chart, like joint replacements or pacemakers or different things that we were like, oh, or anatomical anomalies and things like that, or parts that were missing due to I think one of the cadavers
Mm,
in our lab had cancer and had some things removed, and we're like, oh, that's on the chart. That makes sense. So talking about representation in anatomy, you had some insight on that as well. Here's a question for you: do you want to boost your clinic revenue by $290 per patient per quarter? Of course you do. That's rhetorical. Physiotech's remote therapeutic monitoring can help you do that, enhance patient outcomes, ease provider workload, and turbocharge your earnings. Kickstart with RTM at physiotech.ca. That's physiotech.ca. And the thing you interact with the most at your clinic, if you're a therapist, like it or not, is your EMR. MW Therapy's all-in-one outpatient PT EMR gives you seamless integration of patient portals, marketing automations, and billing, all at one unbelievable value. Switching over is a breeze too. Kick the tires, take a test drive at mwtherapy.com. And where is your PT career going? It's not rhetorical, it's literal. Embark on extraordinary patient care adventures with Jackson Therapy Partners. Visit them at jacksontherapy.com. This is perfect for physical therapists eager to make their mark, to do what you want to do, where you want to do it. Discover where your career can take you at jacksontherapy.com.
yeah, exactly. I did a lot of self study and self exploration kind of coming out of the pandemic about systemic racism, white privilege. I saw my colleagues really leading out in this. I was like, oh, I think I'll start out with looking at, I forget the name of the book, White Fragility. That's the domino that kicked the whole thing off. So I got into white fragility and I went through that. And I was like, oh, okay, like I go through the world with these blinders on and I'm a white male. So things hit me differently than they would hit a black woman and so on, all the infinite combinations. And so that was really cool to study that and just kind of get started in that, as a little side interest. And then I went to an anatomy conference and they had a whole session, a whole symposium on decolonizing the anatomy curriculum. And I'd never heard of what decolonizing is. Like, I've heard of colonization, but what is decolonization?
Right.
I had no idea. But it was like, yeah, like the infiltration of white people into indigenous cultures, and that has persisted and made its way into anatomy education. And that just like that's when like the blinders got completely ripped off. I was like, okay, this is a big deal. Everything I've learned and taught is totally through the lens of like a Eurocentric model. And hey, well, wait a minute. If we have to pick a model of what the body should look like, we're going to pick, like basically a Roman or a Greek god, and we're going to put that in our books. And so that was really interesting to learn about that concept. And then you go to the poster section of the conference, and they actually do things like, okay, here's 10 anatomy books, count the number of times non-white men are listed. And it comes out to being like 8%
Wow.
of images are like that. So that was something interesting and eye-opening. And then we took an inventory survey in the PT faculty. It was the Clifton Strength Inventory, And these are like a dime a dozen. So I did not expect this to be very meaningful at all because I've done all of them, right? There's so many of these surveys. And this one was really neat in that the number one strength I had was inclusivity.
Huh.
And I was like, okay, like, of course, I'm going to get a list of my things. And I started to think about it. I was like, wait a minute. Like, I care about the way people are included all the time in these other contexts. So then I was thinking, let's leverage that strength in this the race space, in the sex space. So I've been working on that. I've been jumping on to a lot of DEI communities, committees on campus. There's a group that I'll plug in the anatomy space called Black in Anatomy.
Yeah, I've seen that.
So just about amplifying, Black contributions and achievements in anatomy, education, research, all of that. And I just thought that, as a white man, it's not fair to put it on the minority individuals to fix these problems. Things need to be dismantled, and I want to be part of that. So yeah, and then again, I'll stop there because it's another hour long, rant coming out. But that's really my experience, answer to your question. Yeah.
Were you shocked when inclusivity showed up on your Strengths Finders top 5?
I mean, I guess initially because I had stereotypes around that, and I looked at what I had been doing with my life and my time, and it wasn't, speaking up for people that look different than me, but I was just living the dream, right?
Yeah.
Living the white dream. So just kind of, blind to everything going on around me in the community, in the classroom, on my campus, you name it. So initially it was a surprise. I was like, wait, what does this mean? It feels kind of soft. I'm a scientist. I'm a guy. What's going on here? That was my initial reaction. Like, oh, this is kind of interesting. But the tool is good because it breaks down, it gives meaning,
Right.
examples, explanations. It's like, oh, actually, that is me. And wait a minute, I've been reading about this. It just kind of all swirled together. And I was like, yeah, this is good. I'm going to ally with Black in Anatomy. I'm going to write articles and blog posts on the subject that amplify women. And I completely cut out the use of eponyms in my anatomy teaching as well.
But the Strengths Finders is just showing you like this is part of your DNA. Like this is your strengths, right? Bringing it to the surface to let you know, like, hey, this is a strength. It seems like it made you question, how am I acting on this strength?
Yeah, like I'm very inclusive in that I care that my daughter is heard at the dinner table because she's the second child, and I feel like as a first child, I feel like we dominate and our siblings don't get heard as much. So I could definitely see inclusivity in a big light, but I was like, wait, it's DEI. Like, what's the I in that? It's inclusivity. And
Right.
I do get really sad and really angry when I see people not, heard and being taken advantage of for really bad reasons, like a construct that is race. There is no racism without race. And look at what we have to deal with. And that really gets me fired up. So it was just like an awakening to like, oh, I can apply that DNA in like a different context. And yeah, it's been really, really interesting for sure.
For me, my results to Strengths Finders, and I took it actually, not to bring her up again, because Sky Donovan and some colleagues at Marymount University gave it as a presentation at, I can't remember, some meeting. They had given it to first year students. And the idea behind it that I took away, Megan Moran was the faculty who was sort of leading that or giving that presentation. When I took it, my results didn't necessarily shock me. It was kind of like astrology, where it was like, oh yeah, like you sort of bet, you're like, yeah, I can see that. Like nothing, it was like communication, ideation, futuristic, woo, like I need people to like me. And I can't remember what my fifth one was.
Yeah.
The value that I found in it was when I learned other people's strengths like who I worked with. And I was like, oh, you like the things that I hate, because I was holding back some things, because I was like, you like spreadsheets? I wouldn't give someone a task because I didn't like it. I just assumed other people wouldn't like it. And then my woo would make me not want to give Mike work that I think is tedious and boring. Meanwhile, Mike is like, your tedious and boring is my apple pie, baby. So it was unique because it let me see other people like, oh, we're not just different like we are very different in what we like and what we think is cool. And that's how you get the most out of a team.
Yep. It was in a team context that we took it. So then the facilitator a week later sent us the spreadsheet that had all of us in rows and all the strengths as columns. and then you could kind of find yourself and you could go across the row, and then you could start to go across columns. It's like, wait a minute. I actually notably was the only one of our 40 faculty that had in their top 10 the futuristic one,
Right.
keeping an eye out on the horizon, early adopter. So yeah, I mean, so then I'm a logical tap for the technology task force at the
Right.
university level for representing the PT program. So very helpful for management and leadership. That was really cool.
That helped me. So I had futuristic too.
Yeah.
That helps me explain when other people don't. And that's not a weakness. It's just they have other strengths. Like it's a strengths finder, not a weakness finder, right? So the
Yep.
idea there was I was like, oh, sometimes I'm too far ahead. I'm not
Ah,
saying I'm fat, I'm smarter. I'm
right.
just, yeah, I'm not paying attention to what's happening here. I'm 10 minutes, 10 days, 10 months, 10 years ahead. And the thing is, don't be frustrated. It's not that they don't like your ideas. They
Yeah.
don't see them yet until you clearly communicate them. Because a lot of times
Yeah.
it's like dot connectors. That's how I think futuristic was explained to me. It was like, listen,
Okay.
somebody drops a new thing in front of you and you go, oh, in the context of all the things I know, what if we, like when I first got to play with that, like
Yeah.
I didn't sit still for like 3 weeks. I was just like, what if we do this? What if we do this? What if we do this? And it was sort of making me spin. But me understanding that about myself helped me sort of like, oh, I need to slow down and very clearly communicate how I got 6 steps away from where we were. Because other people are very thoughtful in the moment. And that's not a weakness. That's why it's good
Right.
to have people with different strengths
Yeah.
on the same team. It's why A Team worked out, man. That's my favorite 80s sitcom, right? If you had 2 BA Barackuses, that wouldn't have been any good. You needed 1 BA. You needed a face man, a Hannibal, and a Murdoch. You get a little bit of this.
The magic.
This is also why I dig heist movies. Like
Yeah.
11, 12, 13, and the Italian Job and all those and like the Bourne Identity. Like it's very
Yeah.
much sequential. I'm like, oh, that's kind of cool how it works forwards and backwards. But
Good formula.
knowing that as a gigantic strength. So you were saying that
Yeah.
you were saying too that one of your colleagues was going to a meeting in Toronto about anatomy.
Yeah, yeah. I don't know how many PTs are aware of this, but the annual association, excuse me, the American Association for Anatomy, they have their annual meeting every March, and so that starts in a couple days now. So Toronto, watch out! A bunch of anatomy educators are about to descend upon you and take over your establishments and educate you, and you might overhear some interesting conversations. But basically, it's the annual meeting, and I'm in a kind of a cadence or a pattern where I go to these meetings every other year. So I did the Washington D.C. meeting in 23, and I'm gonna give this one a pass. But some of my work will be represented there, and yeah, I think it's going to be a great meeting for my colleagues. I'm excited to hear. And anatomy Twitter is strong,
I
so
see.
there's going to be a lot of anatomists tweeting hashtag anatomy 24. Get ready.
What goes on at an anatomy conference? Like, walk me through that.
Well, Jimmy, I've been to as many anatomy conferences as combined sections meetings.
Okay,
So why don't I explain it in that context? Basically, there is a huge venue. There's not as many people going to this annual meeting now. It's almost like we were part of experimental biology, but there were some cons as well as pros with being partnered with like a big conference where a ton of associations came together. So it would almost be like CSM fragmenting and going to like an ortho academy meeting. It's got that small feel. So there's about 1,000 people that go to the anatomy meeting, and you're going to have keynote speaker. You're going to have these plenary sessions. You're going to have symposia. You're going to have platforms where the presenters are fewer, and sorry, not fewer, but the duration of the talk is much shorter. Think like 15 minutes or so, right? So you
great.
have those at CSM for sure. You've got a lot of those going on, and then there's also a poster session
But what are
where
some of the topics? Like, what are you guys talking? Is it's because it's not just anatomy; it's anatomy education. So you get niche within a niche, which to me is when you get people together who geek out on the same
oh
thing.
yeah.
That's when cool stuff happens, in my opinion.
Yeah, I mean, I didn't browse what this year's nitty-gritty like sessions look like. I know that the theme overall for the conference is visualization, which of course everybody says anatomy, it's a very visual subject.
Right.
Really lends itself to that. And I think that they're going to take that from a lot of different angles. There's different ways to visualize anatomy from different technology perspectives. I'm sure there's going to be a lot of 3D modeling represented. And then we also The American Association for Anatomy has a couple journals. There's the Anatomy Education Journal. There's also a I think it's called Developmental Dynamics, and that's more embryology, histology. So there's going to be a lot of staining, a lot of those wet lab intensive techniques that I know nothing about. But that's kind of what the theme is, and I suspect that's what they're going to be discussing quite a good deal about. Um, yeah, so we've got that going on, and then there's also going to be the poster session, and they kind of spread that out. They don't have like one big massive poster session. They just like CSM, multiple sessions across all 3 days of the conference. Nobody wants the afternoon of the last day kind of thing,
Right.
because everyone's packing up and going. So posters are going to be fun. And then there's also an exhibit area. I can't say exhibit hall. CSM has way, way, way infinitely more exhibitors than
Yeah.
the American Association meeting of anatomists will have. There'll be maybe 15 or 20 exhibitors. And I am proud to say that KenHub will be there. So they're going to have about 100 atlases on hand. And I'm not able to go. There's going to be one of my colleagues there holding down the fort, holding down the table. And I don't know what she's going to do. I don't know how it's going to go. But I've encouraged everyone I know to go by and say hi and check out the book.
That's cool. What we'll go with three. What are the three common ways that PT students come to anatomy? Like, there are three common mistakes. That's what people want to know. What are the common things, and how do I avoid them? So what are the three things that come up over and over again in your experience with learning anatomy?
Okay, mistake one, what got me through undergrad will get me through PT school. And I mean study strategies. That's 90% of my office hours. And there's a lot of office hours because it's a big band-aid that gets ripped off after that first exam. And I try my best. I am not the type of academic that's like hiding behind the curtain saying, anything that I say is fair game on the test. Good luck to you. I'm on the other extreme where I have learning objectives. I have a lot of resources that are all aligned with my assessments. Like I'm doing all the best practices, keeping the learner in mind, being inclusive maybe. And I'm keeping them in mind, and I'm trying to give them everything they need, but still bad habits are hard to break.
Yeah.
I put together a lecture that is how to succeed in graduate anatomy. And it's all based on cognitive neuroscience literature. It's all based on make it stick. It's all based on retrieval practice, all those frameworks that have been proven to help out. And so the big mistake number one is students come in with a mentality, I can wait until before the exam to really study hard. I can cram, and then I can forget it, because really, and you've lived it, like PT school is kind of cumulative in a way, right? Like you kind of build on anatomy in your subsequent classes.
Yeah, everything.
You can't just forget it.
Yeah, unfortunately, you got to like remember all those bones and muscles and nerves and tendons. Oh my.
It's a lot of stuff. And so the strategy kind of goes away from let's memorize 10,000 things to let's learn some red line themes throughout the book of anatomy. And muscles can only pull. So if you know the muscles attachments, you can deduce what the action is. We're going to group all these muscles in a compartment on the anterior thigh, and more often than not, the femoral nerve innervates those muscles. Like, let's just see the patterns. Let's unpack things. There's this cognitive load theory.
Sure.
Let's get the extraneous load down so that way we can remember things. So that's what I would say around mistake number one. Mistake number two is kind of interesting. It can be literal and figurative. So literally in anatomy lab, students stay zoomed in very, very long, and they zoom in right away. And there is literature to support this. When histology students look at those digital slides, and you can like seemingly infinitely zoom on these digital platforms, right? So they did the tracking program to track. They said, okay, students, first year students, look at these slides, try to find this thing. And the students went right in right away, and they spent like 70% of their time really zoomed in. Then they gave the same questions to the like 20-year veteran histologist, the pathologist. They stayed zoomed out longer. They spent less time zoomed in. So basically, when you're in an anatomy lab and you have something that you're trying to identify, there's a string tied around a nerve in the neck. Oh my gosh, and so anything in the neck is insane, right? So there's a nerve in the neck. So being able to identify it's a nerve is not trivial. But then the students will stay so zoomed in on that string, on that nerve, that they'll ultimately run out of time and they'll just name something. But when I come by, I like to narrate for the students what the process is. Okay, So where is this a nerve? Okay, we talk about why it's a nerve. What's it in front of? Oh, okay, it's anterior to a muscle. What muscle is it? Well, it's going from the neck to the first rib. That's the anterior scalene. So if there's a nerve anterior to the anterior scalene, it's the phrenic nerve. And even zooming out more, okay, if it's the first rib, then where's the clavicle? So that's another big mistake that students literally make in lab is they zoom in really quickly and they stay zoomed in and they're just hyper
You know,
focused.
look at this, right? Their whole life is with these digital devices and these phones. I can
Mm,
zoom in on answers to questions. I don't have to type anymore, Mike. I just hold the button down and ask this little assistant to like find
yeah,
me the answer. And soon it won't even be find me the answer. It'll be like think of the answer, right? Not just recall and finding, right? But that's what you're saying
yeah,
is it'll be able to just generate the answer. But how many times my professors had said the same thing, which is like, listen, put this in context. What do you think it does? Take and narrow it down, right? So I like what you're saying is don't miss the forest for the trees.
yep, exactly. And that happens during the kind of the lecture sessions before the exam. The students are asking these very, very detailed, specific, I call them pine needle questions
Right.
on the tree of the forest. And then I say, you're asking me about something that is not related to a learning objective. I'm super glad you're curious. I will never squash anyone's curiosity, but we have limited cognitive capacity. Let's maybe redirect and reorient because this is not part of a learning objective. So
I remember when we were learning neuroanatomy, and I was studying with, I call them kids. I was colleagues, now colleagues, but they were 10 years younger than me. And I remember thinking, this was again advice from a professor. It was like, listen, a lot of this stuff is important to know that it exists, but I'm never going to be looking at neuroanatomy in person. If I can see someone's brain or some of their organs, they need direct pressure in an emergency room, not me. I will see them later, and then I can take the time, breathe, think about what this person can do, treat what you see. So a lot of times it was like this is
good.
nice to know and understand the big picture. But I got caught myself zooming in and saying, "What's this little thing right here?" It's like, dude, is that going to matter? Is this nice to know or need to know, right? So being
Yeah.
able to zoom out. And what's number
Yeah.
3?
Oh man, number three. Let's see here. So those two jump out immediately. Your question was
Yeah, most common
mistake,
errors or
most
FAQs
common
or
errors. I mean, I do get worried about the students that come in and they don't bring any other side interest with them. They don't bring any hobbies and they don't take mental health breaks. You can kind of tell. I mean, it is personal, so I don't press on this issue, but we are trying to be better at, assessing and working in that affective domain. It's not always cognitive, but we want to make sure that the student as a whole is doing good. We want to make sure that they're having mental health breaks. And students will kind of think like, the harder and longer I hit this, the smarter I'm going to be.
right.
And, diminishing returns and all that literature is not the case. So I think maybe right out of the gate, when you get into PT school and you're in anatomy and you want to learn it all and demonstrate it all, I think you can let those other things fall to the wayside. And I think that that is a pretty common error.
Yeah, I was
Yeah.
guilty of that while simultaneously knowing. I'm not sure what that concept is called. Is knowing you're doing the wrong thing, but doubling down on the wrong thing. And being, well, I'm the exception, not the rule.
Oh boy, masochism, right? It's like self punishment. I know I shouldn't do this, but here we go twice as hard.
I also want to make sure I'm not the one in my class who's not studying for the 30 hours. I mean, my thing was I could study for 8 hours or 18 hours, and I was most of the time walking away with the same grade. I was also walking away
Mm,
a little more tattered, a little more bruised up for the next test if I was studying for the 18
mm,
hours when I didn't need to do it. I knew this. I ignored this. I kept
mm.
going.
Yeah,
Big dumb
yeah. Saying
idiots.
it is one thing, doing it is another. I know that for sure.
Yeah. Mike, we have a feature on the show called the parting shot. Are you ready to do your parting shot?
Yeah, let's do it. Tell me what that's all about.
Parting
This
shot.
is the parting shot.
Your chance for a mic drop moment, a soapbox statement. Batting average wise, educators always have at least one of these things. And you usually say it on the first day of class. You're like, you're going to hear this all semester. So what is that thing for you? What's the thing that if you were going to put on a billboard for students, what would it be?
Yeah. I think that I'm channeling, day one, and one of the most common questions that students ask, or that you can see in their face, like, how am I going to do this? How am I going to get this done? So I would say that it's really valuable to, again, like, step back, not to be too zoomed in, but step back and look at your approach to the course, look at your approach to PT school, really. And don't be afraid to ask for help. What we really do well in PT education is we remove that distance between the teacher and the student. We don't use Dr. Pascoe, we use Mike or Pascoe. So being really willing to make mistakes, I really try to create that environment, and I want students to make mistakes so we can get further down the road and get closer to mastery. That's what I would say.
Love it. Mike, congrats on the book again. We'll put a link in the show notes for people to be able to check that out. But good for you for continuing to do this and really help students out.
Yeah, it's a privilege. It really is. I'm in a fortunate place. I benefited from privilege my whole life. And so don't forget to pay that back and to keep an eye out for ways to amplify others. It's been great.
Excellent. Mike, thanks so much for the time, man. Appreciate it.
Sure thing. See ya.
You see, the best conversations happen at happy hour. Thanks for coming to ours.